Hi, friends. We are coming to the close of the year 2025, which was a great year for the progress in cardiology, at least. And let me talk about some important points which we have gained in this particular year. First of all, the landscape of cardiac sciences in this year has moved beyond management towards precision, regeneration, and prevention. And these developments are fundamentally changing patient outcomes by reducing hospital stays, minimizing surgical trauma, and tailoring treatment to the individual patient's needs. The most important thing which has happened is the metabolic cardiology and focus on weight management, improving the heart health. We know that obesity is a disease, and one of the most significant shifts has been the popularization and the clinical trials on GLP-1 analogs, semaglutide and tirzepatide. Both have been recognized as very core therapeutic agents for the management of obese diabetics, and they reduce the major risks of cardiac events by roughly 20 to 30%. And not only in obesity, but also in patients who are obese and have heart failure, and obesity is frequently associated with heart failure. And also, it's not purely in diabetics, but in non diabetics, obese patients. This is again very useful. Well, a great news for persons of our South Asian ancestry who have traditionally high and very high triglycerides has been a triglyceride revolution. A new drug, olviceran or olzisarsan, and DR10624, which is a triple receptor agonist, has led to 60% reduction in triglycerides. And with nearly 50% of the patients with high triglyceridemia, and when I mean high, very high triglycerides, something like 400, 500, 600, it can reach the target of maybe 150 milligrams. This leads to substantial reduction in liver fat, benefiting those with fatty liver, non alcoholic steatohepatitis, hepatitis, besides improving the lipid profile. All this provides a new option with very high triglycerides, not only reduces pancreatitis but also cardiovascular diseases. In the field of coronary artery blockages, drug coated balloons as the sole strategy instead of caging the artery as we very often do with drug eluting stents. A trial solution de novo trial suggested that in many patients, leave nothing behind after the angioplasty is the best approach, and the balloon delivers the drug to the vessel wall, and no permanent metal is required in large majority of patients. It is just as effective and reduces long-term complications. This, along with many more similar studies, have revolutionized this development. The need for blood thinners, that is, antiplatelet drugs, is much less and is especially also very important for those who have high bleeding risk. And as you know, 25 to 30% of patients who undergo angioplasty are high bleeding risk patients. Then, replacement of diseased heart valves without opening the chest has become a standard of care in patients with, severe aortic stenosis, especially in the elderly people. But now, younger patients with very low risk have also been shown to benefit by this procedure, and this is becoming a very popular procedure. And aortic valve replacement surgically is not really required in most of the people. But besides this, the other developments have been the TR procedure, that is transcatheter edge to edge repair, which has been done in a selected number of patients with mitral regurgitation, especially with the dilated hearts and heart failure. But this also has now been extended to the forgotten tricuspid valve, where the TR repair is very successful in those patients who have got a tricuspid regurgitation and were previously on high doses of diuretics and liver enlarged and heart failure. They can be approached by this particular method. I think it's a good big revolution. Finally, the artificial intelligence and new diagnostic standards. AI is no longer a futuristic concept, it's now an active bedside tool improving diagnostic accuracy of common investigations like echocardiography. And here it's how it can do. Well, EcoNet is one of the ways that you do an echocardiogram, and this was first shown by the Stanford University Hospital. These algorithms they combine or compare it with thousands or millions of echocardiograms and then come to an algorithm and try to find out that besides what you are seeing directly in the echocardiogram, it can also tell you what in the future can happen when you compare it with similar large number of database echocardiograms, which particular patient is going to get into heart failure, which particular patient is going to get into problems related to LV function, systolic dysfunction, diastolic dysfunction. This is a big achievement. Similarly, other, Pan Eco, which is more recent, and it has been shown that in Yale University, they have even improved on this particular investigation, this particular way of using the artificial intelligence. They go and combine and compare even a larger number of databases all around the world, which are available, and then predict like an astrologer what can happen to this particular patient in a given particular period of time. Similarly, the wearing wearable devices on the wrist, like a wristwatch, can, besides giving you the ECG, atrial fibrillation, and others, which has become very common now, they can also tell you which particular patient, which particular person is going to have a weak heart in the future, and up to 86% sensitivity before even the patient feels the earliest symptom. I think this again is a very big, addition to our armamentarium. Then coming to regenerative and genomic medicine, we are entering a era where the heart damage might be reversible. Cardiac regeneration in 2025, researchers have successfully used stem cells to re engineer the damaged heart tissue at the cellular level, offering hope for patients with end stage heart failure who previously had no option except for a heart transplant or an artificial heart. Uh, so this again is a very promising development, and I'm sure this is going to be taken into the future. And finally, a single dose gene therapy, verve 101 and verve 102, is an experimental gene therapy which is developed by a company which is owned now by Eli Lilly in USA called the Verve Therapeutics. And what they do, they have developed a genetic medicine for cardiovascular disease by which you just give a single injection and your LDL cholesterol can be reduced by about 50%. And this uses RNA technology in the liver, and it potentially eliminates the need for taking daily pills, which a large population which we treat as a cardiologist do. So, ladies and gentlemen, this is, I think, a very important development, and all these four or five things which I told you are going to reshape the cardiology in the years to come. Thank you very much, and wish you all a very happy new year 2026. Thank you very much.